Which tobacco-related diseases are covered by the Quebec CQTS-Blais Tobacco Class Action? In order to qualify for compensation, a smoker or ex-smoker must have been diagnosed in Quebec before March 12, 2012 with one of the following diseases. 1. Primary lung cancer. 2. Primary throat cancer, specifically squamous cell carcinoma of the larynx, oropharynx, or hypopharynx. Or 3. Emphysema or COPD having reached gold grade 3 or 4. What qualifies a cancer as primary? Primary cancer, as opposed to secondary cancer, specifies the organ in which it first appeared. Secondary cancer implies that the initially localized cancer has metastasized and spread to one or more other organs. Kidney cancer initially develops in the tissues of the kidney. It may then metastasize and develop in the lungs. In this example, even though cancer cells may have developed in the lungs, the cancer is not considered a primary lung cancer. It is a primary kidney cancer and is therefore not covered by the class action. Which throat cancers are covered? The term throat is regularly used but is not a medical term. In reality, what we commonly call throat includes several parts of the upper aerodigestive tract, but not all of which are covered by the class action. The oral cavity, commonly called the mouth, is not included, but the larynx is. 2 of the 3 parts of the pharynx, the hypopharynx and oropharynx, are included. Furthermore, the oropharynx contains several structures, including the posterior third of the tongue, also known as the base of the tongue. However, the anterior 2/3 of the tongue, also known as the body of the tongue, is rather considered a structure of the oral cavity. This portion of the tongue is therefore not covered by the class action, whereas the posterior third is. So if you've been diagnosed with throat cancer and you're not sure whether it's covered by the class action, register anyway. What's the difference between emphysema and COPD? Emphysema is a degenerative disease that occurs when lung tissue breaks down and loses its elasticity. Emphysema, chronic bronchitis, and asthma are part of what is known as chronic obstructive pulmonary diseases, COPD. Although these 3 diseases are different, they share symptoms such as shortness of breath, chronic cough, increased production of mucus, sputum. The current trend in the medical profession is to diagnose COPD, whereas in the past it was rather to diagnose emphysema. Since clinical practices have changed over time, the class action covers both emphysema as well as severe and very severe COPD, that is gold grade of 3 or 4 respectively. Do you have questions or doubts about your eligibility? Contact us at tabac@proaxio.ca or by phone at 1-888-880-1844.